Hi, I'm here with Anna, who is one of the researchers on this statewide evaluation of California. And we're here representing the Southern California HIV Policy Center, and we're so excited to learn more of this statewide evaluation on pharmacist-initiated PrEP medications, and would love to hear more about this research initiative, what it's evaluating, and yeah, could you orient us, please?
Sure. So we did an evaluation that was across the state using a mystery client caller. So we trained a couple research analysts and assistants to call and act as a person looking for either pre-exposure prophylaxis and or post-exposure prophylaxis. And in the state of California, it is allowed based on these two bills to prescribe through the pharmacy. And unfortunately, we're seeing just across the state a really low uptake of these bills. And only about 2% of pharmacies have shown us that they are able to prescribe to individuals who just call looking for a prescription.
That's surprising for California, right? How would you say that has? What does that have to do with the challenges maybe that pharmacists are facing? Is it an insurance issue? Is it reimbursement issue? What did the research find?
Yeah, I think that this research didn't necessarily look at the specific barriers. We were transcribing all of the phone calls, so we were able to just pick up information that they wanted to give. I think demand is definitely an issue. A lot of pharmacists both said that they never had anybody ask for the medication before, even though they were allowed to prescribe it. But I think a lot bigger issues exist, and that's definitely the policy and reimbursement. So a lot of pharmacies are just not getting reimbursed for the prescriptions that they're providing to people, and that's due to kind of a separation of how the prescription and the actual medical services provided. They're both pharmacy benefits and medical benefits, and pharmacies are not currently getting reimbursed for all portions of the visit.
Understood. Was there anything around capacity building for pharmacists that was found in the evaluation? Do pharmacists need more training to initiate PrEP uptake?
Yeah, I don't think that this research necessarily can answer that question. I think, again, we were able to kind of glean a bit of information because pharmacists would tell us, like, I don't know about that law, or I've never heard of this before. Some people had never heard of PrEP before. Yeah, but I don't think that information can be gleaned from this study. I know a collaborator down the road from here has some information on that.
Okay. Well, with the evaluation, what did the evaluation hint towards when it comes to further policy and further research that needs to be done to inform policy design and policy advocacy?
Well, shameless plug, we have another research study coming up that's going to be evaluating the actual barriers that pharmacies are facing. So it's going to be an individual level survey to each pharmacy. And I think that's going to help us really figure out what pharmacists see as the greatest barriers, because we can look at these bills that authorize the prescription. But, obviously reimbursement we've seen from this study, or not this study, but prior studies and other studies on pharmacies show that reimbursement is, a huge issue, as well as time. But I think that further study will definitely illuminate some of those barriers.
Thank you. Is there anything else that you wish to highlight from this statewide evaluation?
I don't think so. I definitely want to highlight all our collaborators and you guys as well. You guys have been really instrumental in collaboration. So,
yes, shout out to all the collaborators here, including Ayako, Ochoa, Ishita.